Hi, I'm Linda Minghella, and I'm the Vice President and Chief Information Officer for Boulder Community Hospital. Our hospital is a 265-bed hospital located in Boulder, Colorado, and we're actually two inpatient facilities that are located about 5 miles apart. In the last 5 years, we've had a major initiative. We went from having Meditech Magic to Meditech 6.0, and at the time we had no clinical applications live in our environment. In that process, in that 5-year process, the last thing we had time to worry about were the interfaces. And that's where our partnership with Summit really came in. It allowed us to really focus on more of the clinical services and getting adoption of the electronic health record, getting our physicians on board, getting our nurses on board. And we didn't really have the time or the capacity to really worry about how we were going to interconnect all of these systems, and not just the 44 that we did in 2009. I'm sure our count is probably closer to 100 at this point, and it continues to grow as we bring in new systems. We had 44 interfaces. Very few of those interfaces were forward focused to our physicians in our community, and more people ask for more data. I mean, that's really what's happened in healthcare. It starts to become about the data and getting it to where the patient needs to be or where the patient is, and we can't do that if we keep all of our data in our own systems and don't share it. And there were a lot of folks that were skeptical. We had those two interface engines in place, and folks liked it. They knew how to manage it, and they didn't really want to see it go away. And so we demonstrated the Summit Connect product to the staff here at PCH, and they were blown away at the tool set and how easy it was to manipulate the interfaces. So with our relationship with Summit Healthcare, we were able to connect directly to some of the large providers in our community and use the provider exchange not only to send results but to also receive orders inbound into the hospital, which streamlined both the workflow for the physician clinic as well as for the hospital. The outsourcing agreement with Summit is really important to us because they can do things much faster than we can with our internal staff. We have a lot of projects at any one given time within the hospital. It's almost never ending, and meaningful use and the healthcare requirements really are changing the game at the speed at which we need to provide services or integration with other organizations. We really did set the bar. We were really instrumental in helping Creo get to be the first health information exchange in the state, and they had no experience doing this. They were partnered with a company called Medicity. By connecting Summit Healthcare and the vendor partner, literally within 2 one-hour phone calls, they had that interface up and running. The thing that I always tell folks when I talk about our relationship with Summit Healthcare, in my experience in working with them, I've had many instances where we've been in a crisis. You know, I don't know any hospital IT department that's not been in the situation where you have an implementation or you have something that happens that you need something now, and Summit has never let me down. And anytime we've been faced with a challenge in the hospital and we recognize where Summit can play a role, it's usually just reaching out to them and letting them know what that need is, and we work through what that looks like and how we can achieve that together. And that's really what Summit brings to the table. They're not really vendors to us. They're really partners, and we've had a long-standing relationship and expect to continue that relationship long into the future.